Shoshana at KCM Hospital in Niagara, Poland. Shoshana, tell us a little bit about yourself. What was the problem and how have you found it?
Okay, well basically I'm 23 and I'm from Northern Ireland. I would generally be quite an active person, so I would, do all sorts of different sports. Obviously I'm still quite young. So in the midst of some of my sports, I got a back injury. I went to the doctor in Northern Ireland, did the various tests, and they advised me that I would need surgery in order to get the problem fixed so that I could get back to my training. So with Northern Ireland, with the surgery waiting list of the NHS, for an urgent referral for the type of back surgery that I would need would be a year and a half would be the minimum waiting period.
The waiting period, a year and a half?
A year and a half, and that's the most urgent sort of back surgery. So obviously if it wasn't as serious, it would have been even longer. Obviously, I'm only 23, I'm in university, I do a lot of sports, I don't have time to wait.
You cannot afford waiting 18 months.
Exactly, and I've already been waiting since sort of 11 months as it is. So I decided to have a look into other options and, obviously to see if I could get it quicker and obviously to see what different types of treatments are available, because the treatment that I was offered back home in Northern Ireland, it would just be a microdiscectomy. Because I have a large disc protrusion in one of my discs in my back, so what they wanted to do in Northern Ireland would be just to remove the affected disc. But once that structure is removed from my back, I wouldn't have that much movement.
You would never have that much movement.
Yeah, so obviously it would change my lifestyle completely. Sports, I wouldn't be able to get back to,
So that was not an option for you?
Yeah.
And you decided to look for a minimum invasive solution?
Exactly. I decided to look for something that would sort of allow me to obviously recover and be able to live at the same standards which I lived beforehand. So I had a look online, researched the different treatments available, and I came across minimally invasive surgery. These techniques basically allowed me to be fixed but also carry on the same lifestyle and sports of which I did before. So I had a look online. There were various different clinics all around the world, which are especially designed for medical tourism. So obviously I researched it as best I could in all the different ones because I wanted to be sure that I get the best treatment possible, so that I can recover as quickly as possible and I have faith and confidence in the place that I'm going to.
Of course. Was the price factor important here during the comparison of all the options?
Yeah, well, ideally for me it was more to get myself fixed and back to the standard of living, which, obviously that I was accustomed to beforehand. Obviously the price factor is a big influence in Northern Ireland. In order to go private for the basic microdiscectomy, it was very, very expensive. But even that surgery wasn't going to, if I got that surgery, I wouldn't be in pain, but I wouldn't be able to do sports, I wouldn't be able to carry on living at the same standard. So I had a look, obviously, in KCM Clinic, and obviously I got a lot of information from yourself, and I contacted you. You were extremely quick.
So the communication was quick,
brilliant,
and
perfect
precise.
communication. I think the first email I sent you, I think you called me 10 minutes later, so
Wow.
it was sort of like, oh okay, I was very impressed. So yeah, you were very helpful, answered all the questions. I didn't feel like I was being forced or rushed into anything that I didn't want to. You offered all the information I needed. And yeah, I was quite impressed with the communication.
And the dates we gave you at KCM Hospital were for you flexible enough?
Yeah, I mean, they were really flexible. I was offered a few different dates, which, were very soon, which was brilliant, because obviously I've been waiting so long, I wanted to get this fixed as soon as possible. So, the dates were perfect. I was given a few options. I wasn't being pushed into any specific date. It was more around what would suit me best. So no, it was brilliant in that way.
And the process in Poland here, the package in terms of medical tourism, we picked you up from the airport to the hotel booking, everything was arranged by the hospital?
Yeah, it was indeed. So it was the complete package, so I didn't have to worry about, booking hotels, finding taxis, anything like that, which I do think makes it a lot easier, because obviously whenever you're going for surgery, you're worried, you're environment, completely different culture. You just want to get in, get fixed, and know that you're in safe hands. So the airport pickup was perfect. It was on time. They brought us straight to the hotel. You know, we left our bags, and then we came to KCM to get the
test
and
and consultations.
Yeah, and everybody was very friendly. You know, I couldn't really have asked for anything better.
So your minimal invasive spine surgery was 2 days after arrival in Poland?
Yeah, it was indeed. The first day I got, you know, blood test diagnostics. Second day, MRI. So it was good because I felt like all the bases were covered. You know, they were doing all the tests to make sure that that was exactly the right treatment for me. And then on the Friday, I had the surgery. Yeah.
And before surgery, obviously, you had a consultation with the doctor who really explained to you and showed you on the computer what exactly he's going to do and what he's suggesting?
Yeah, I did indeed. They went through all the different sort of procedures, you know, they kind of advised me on everything that would be happening, so I was quite confident.
And what was the name of the professor?
Professor Quick.
Yes, Professor Quick was it's KCM's spine surgery department.
Yeah.
So the surgery was very quick. You look amazing. Your recovery is very quick. As you see.
So I mean, it's getting better every day. Obviously, the first couple of days I was a bit sore, but that's a given for any surgery. You know, it's 2-3 days after the surgery now, and I'm back to sort of normal. It's just literally the last wee bit of just a bit raw from the surgery, but it's, I'm feeling great. I'm ready to go home and ready to get back to.
And you are right now 3 days after surgery?
Yeah, I am indeed.
And it was elastic Dion implant by Medtronic?
Yeah, it was indeed. So I believe with that implant, it allows you to have sort of more movement so that you can do sports.
Yes,
so it's not
just
elastic.
elastic.
Yeah, so it's not just it's a structure. It's not just structure back. So.
Would you recommend KCM Hospital for other patients looking for spine treatments?
Yeah, I mean, I would definitely recommend KCM. Obviously, in the UK, they don't have these type of advanced procedures. Obviously, you've got waiting lists. It's a lot more expensive. KCM was brilliant because they did cover every base. I was confident in every step of the way. So yeah, I would definitely recommend them.
My name is Philip Pastor at KCM Clinic. Shoshana, thank you very much for the interview.